there's the blockage. That's the number one cause of a stroke if it's in the carotid arteries. It's the number one cause of a heart attack happening in the heart muscle. So can you see by what I've shown you here, it's not one thing that causes heart disease, it's a whole lot of little things. Can that be cleared out? Absolutely, it can be cleared out.
Every year, strokes affect millions of people around the world, many of whom are seniors. In fact, strokes are one of the leading causes of death and long-term disability in older adults. But what if I told you that there is a 3-minute trick that could stop a stroke before it becomes fatal or causes irreparable damage? You're probably thinking, how could something so simple and fast really make a difference? Well, that's exactly what we're going to uncover in this video. Today, we'll talk about a stroke, how to recognize the first signs, why time is critical, and most importantly, how you can take action immediately before help arrives. If you've ever wondered what to do if you or someone you love experiences the first signs of a stroke, you're in the right place. We'll walk you through a simple yet incredibly effective method that can potentially save lives. So, let's dive in and learn how this 3-minute trick can stop a stroke in its tracks. Before we get started, please remember that while the information provided here can be extremely helpful, it is not meant to replace professional medical advice. Always consult your healthcare provider before trying new methods, supplements, or treatments. Before we start, drop in the comments from where you are watching this video and what health topic you'd like to see in the next video. As a special thank you for joining us today, we're giving away 100 free copies of my best-selling book to subscribers. So, if you haven't already, make sure to hit that subscribe button and leave a comment about why you want to win my best-selling book. Recognizing the first signs of a stroke. When it comes to strokes, time is your most valuable asset. A stroke occurs when there's an interruption in the blood flow to the brain, which can be caused by either a blockage or bleeding. This disruption damages the brain cells, and every second counts. The longer the brain is deprived of oxygen, rich blood, the greater the chances of permanent damage. Knowing the signs of a stroke early is crucial because it gives you the opportunity to take immediate action. Recognizing the symptoms right away can save precious time and, more importantly, lives. The common signs of a stroke. There are several common signs to watch for, which can help you identify if someone is having a stroke. These signs happen suddenly and they are often easy to spot. 1. Facial drooping. One of the first signs of a stroke is a drooping or numb feeling in the face. If one side of the person's face starts to sag or they experience difficulty smiling or closing their eyes, this could be an indication of a stroke. You can perform a quick test by asking the person to smile. If the smile looks uneven or one side of their face droops, it could be a stroke. 2. Arm weakness or numbness. Strokes often cause sudden weakness or numbness in one arm. If a person experiences difficulty lifting one arm or feels a strange heaviness in one arm, it's time to be concerned. You can test this by asking the person to raise both arms at the same time. If one arm drifts downward or they can't raise it at all, this is a strong sign of a stroke. 3. Speech difficulties. Slurred or jumbled speech is another major indicator. A person may suddenly have trouble speaking or understanding speech. If they are having trouble pronouncing words clearly or speaking at all, it's time to call for help. 4. Sudden severe headache. A sudden intense headache with no known cause can be a sign of a stroke, especially if it is accompanied by nausea, vomiting, or dizziness. It's important to note that not all strokes cause headaches, but when they do, it's typically sudden and very severe. 5. Sudden confusion or trouble understanding. If the person is suddenly confused or cannot understand simple instructions or questions, this could be a sign that a stroke is occurring. They might appear disoriented, have trouble concentrating, or seem lost in thought without a clear reason. What should you do when you notice the signs? The key to surviving a stroke is quick action. If you or someone you know starts showing any of these signs, it's important to act fast. Don't wait for the symptoms to get worse. In fact, the quicker you react, the better the chances of recovery and minimizing the damage. Call emergency services immediately. In the United States, the number to dial is 911, but be sure to know the emergency number in your country. While waiting for help to arrive, it's crucial to stay calm and follow the next steps that we'll discuss in this video. The 3-minute trick that can stop a stroke. We've established that time is critical when a stroke is occurring, but here's where the life-saving 3-minute trick comes in. The method I'm about to share with you can stop a stroke in its tracks, or at the very least slow its progress, giving you more time to get the help you need. So, what is this trick? The trick involves a simple yet powerful technique that anyone can perform in under 3 minutes. It's based on the concept of activating certain parts of your body that can help restore blood flow to the brain and slow the damage caused by a stroke. It's a method that can be done before help arrives and can potentially prevent a stroke from worsening. Step 1, call for help immediately. This might seem like an obvious step, but it's so important that it needs to be emphasized. The moment you recognize the symptoms of a stroke, the first thing you should do is call for emergency help. Time is of the essence, and medical professionals are equipped to handle strokes and provide the care needed to limit the damage. Step 2, the trick using the tongue. Now here's where the 3-minute trick comes in. The trick involves the use of your tongue and pressure points on the body. Tongue pressure. To perform this technique, the person who's experiencing the stroke should press their tongue against the roof of their mouth. This simple action may sound strange, but it helps stimulate the brain and restores some of the lost blood flow. The roof of the mouth is connected to important neural pathways that send signals to the brain. By pressing the tongue firmly against the roof of the mouth, you help activate these pathways, which can have a positive impact on the brain's circulation. Pressure, points on the hands. Another part of the trick involves using specific pressure points on the hands. The person experiencing the stroke can gently press on the soft part of their palm, between the base of the thumb and the index finger. This can be done by using the thumb of the other hand to press down on this area. This technique has been known to trigger blood flow to the brain and reduce the symptoms of a stroke. Why does this trick work? The reason this trick works is based on the concept of redirecting blood flow and stimulating neural pathways that are involved in stroke recovery. The mouth and hands are closely linked to the brain, and by activating these areas, you can influence the brain's circulation and potentially stop the stroke from progressing further. And this trick doesn't replace professional medical treatment, but it can provide you with crucial minutes to get help and potentially prevent long-term damage. Staying calm during a stroke emergency. One of the most important aspects of dealing with a stroke is staying calm. In an emergency situation, panic can cloud judgment and hinder your ability to act quickly and effectively. It's crucial to remain as calm as possible in order to perform the 3-minute trick and take other necessary actions. Why is staying calm so important? When someone experiences a stroke, their body goes into a state of stress. This can cause the blood vessels to constrict, which may worsen the stroke symptoms. However, if the person remains calm, their body can focus on healing rather than adding additional stress to the system. This is particularly important when you're trying to implement the 3-minute trick and waiting for medical professionals to arrive. Mental techniques to stay calm. Here are a few techniques that can help reduce anxiety and stress in this situation. Deep breathing. Encourage the person to take slow, deep breaths. This helps to slow down the heart rate and calm the nervous system. Reassurance. Offer reassurance that help is on the way and that there is still time to take action. Focused attention. Direct the person's attention to the 3-minute trick rather than the panic. Focusing on something simple can help reduce anxiety. Strengthening your stroke defenses. While the 3-minute trick can help in the event of a stroke, the best defense is always prevention. Taking steps to reduce your stroke risk can go a long way in protecting your health, especially as you age. Let's explore a few lifestyle changes and habits that can help you build stronger defenses against strokes. 1. Healthy eating habits. A healthy diet plays a significant role in stroke prevention. Eating foods that support good circulation and heart health can help lower your risk of having a stroke. Focus on a diet that includes fruits and vegetables. These are rich in antioxidants, fiber, and nutrients that promote overall health. They help reduce inflammation in the body and keep your arteries clear of blockages. Whole grains, oats, brown rice, and whole wheat are excellent sources of fiber and provide steady energy without spiking blood sugar levels. Healthy fats include sources of healthy fats like olive oil, nuts, seeds, and avocados, which can help manage cholesterol and reduce the risk of cardiovascular issues that may lead to strokes. Lean proteins, fish, poultry, legumes, and tofu are great sources of lean protein that support overall body health, including muscle and brain function. By sticking to these types of foods, you're building a foundation for strong cardiovascular health, reducing the chances of conditions like hypertension, high blood pressure, which is a major stroke risk factor. 2. Regular exercise. Engaging in regular physical activity strengthens the heart, boosts circulation, and lowers high blood pressure, one of the most significant stroke risk factors. If you're unsure where to start, here are some simple exercises seniors can incorporate into their daily routine. Walking. One of the easiest and safest exercises for seniors, walking can be done at your own pace. Aim for at least 30 minutes a day. Stretching and flexibility exercises. These can help improve mobility, blood flow, and prevent falls. Strength training, lightweight training, or resistance exercises can help maintain muscle mass and improve overall health. If you're new to exercise, it's always a good idea to speak with a doctor or a physical therapist who can tailor a program to your needs. 3. Manage your blood pressure. High blood pressure or hypertension is one of the leading causes of strokes. Regularly monitor your blood pressure, and if it's too high, make the necessary lifestyle adjustments or take prescribed medications to manage it. Reducing salt intake, staying active, and reducing stress can all help keep blood pressure under control. 4. Quit smoking. Smoking increases the risk of stroke by causing the blood vessels to constrict, making blood flow more difficult. The toxins in cigarette smoke can also contribute to the buildup of plaque in the arteries, which can block blood flow and lead to a stroke. If you smoke, seeking help to quit is one of the best decisions you can make for your overall health. 5. Limit alcohol intake. Excessive alcohol consumption can raise blood pressure and contribute to weight gain, both of which are risk factors for stroke. Moderation is key. Limit alcohol to no more than 1 drink per day for women and 2 drinks per day for men. Understanding the medical side of strokes. To better understand how the 3-minute trick works, it's essential to know what happens inside the body when a stroke occurs. Let's take a deeper look at the medical side of strokes, including the different types, how they affect the body, and why time matters so much. Types of strokes. There are 3 main types of strokes: ischemic, hemorrhagic, and transient ischemic attacks, commonly known as mini strokes. Each type of stroke affects the brain in different ways, but they all share one common denominator, a disruption in blood flow. 1. Ischemic stroke. This is the most common type of stroke and occurs when a blood clot blocks or narrows an artery leading to the brain, depriving it of oxygen-rich blood. Ischemic strokes account for about 85% of all strokes. They can be caused by conditions such as atherosclerosis, buildup of plaque in the arteries, or atrial fibrillation, irregular heart rhythm. Second, hemorrhagic stroke. A hemorrhagic stroke happens when a blood vessel in the brain bursts, causing bleeding in the surrounding brain tissue. This type of stroke is often linked to high blood pressure, aneurysms, or head trauma. It's less common, but typically more deadly due to the increased pressure on the brain. 3. Transient ischemic attack, TIA. A TIA is sometimes called a mini stroke because the symptoms are temporary and often resolve within a few minutes to hours. Though TIAs don't cause permanent brain damage, they are often a warning sign of a future stroke and should never be ignored. How strokes affect the body. When blood flow to part of the brain is blocked or interrupted, brain cells in that area begin to die due to lack of oxygen. This can result in various physical and cognitive impairments depending on which area of the brain is affected. For example, a stroke affecting the left side of the brain may impair speech and motor skills on the right side of the body, while a stroke affecting the right side of the brain may cause weakness or paralysis on the left side of the body. In some cases, strokes can result in memory loss, difficulty understanding speech, or problems with coordination. The damage caused by a stroke is directly linked to the amount of time the brain is deprived of blood. The longer the blockage remains, the more severe the damage. This is why quick action is essential in stroke prevention and recovery. Why time is critical. The phrase "time is brain" is often used in the medical world when talking about strokes, and for good reason. For every minute a stroke goes untreated, around 1.9 million brain cells die. That's why immediate action is so crucial. The earlier a stroke is treated, the better the chances of recovery. Medical professionals have treatments that can break up blood clots or repair damaged blood vessels, but these treatments need to be administered within a specific time frame to be most effective. In some cases, this window is as small as 3 hours, which is why performing the 3-minute trick could be a game changer while waiting for help. The role of a support system. While the 3-minute trick can be life-saving, it's also important to emphasize the value of a support system when it comes to stroke prevention and recovery. Having a network of friends, family members, and healthcare professionals can make all the difference in identifying early symptoms, providing care, and ensuring proper follow-up treatment. The importance of family and friends. Having people around who can quickly recognize the signs of a stroke can save valuable minutes. For seniors, it's crucial to have someone nearby who is familiar with their medical history and can act swiftly when something goes wrong. Often, the symptoms of a stroke can be subtle and people may not be able to recognize them in themselves. If you're living alone, consider having a trusted friend or family member check in with you regularly, especially if you have a history of hypertension or other stroke risk factors. Knowing that there's someone who can act immediately in an emergency gives both the person at risk and their loved ones peace of mind. Building a stroke plan. What to do in an emergency. It's always a good idea to create an emergency plan in advance. The plan should include the steps to take if someone experiences a stroke, including how to recognize the symptoms, when to call for help, and how to perform the 3-minute trick. It's also important to make sure your family or caregivers are aware of your medical conditions, any medications you take, and your stroke risk factors. In an ideal world, you would be surrounded by people who understand stroke symptoms, know how to act, and can help you in those crucial moments. However, if you're on your own, it's vital to take charge of your health and have a clear understanding of what to do if the worst happens, professional care after a stroke. After experiencing a stroke, immediate medical intervention is essential, but recovery doesn't stop there. Stroke rehabilitation typically includes physical therapy, speech therapy, and other specialized treatments to help regain lost abilities. Having a support system that can encourage you through the rehabilitation process is key to long-term recovery. For those who have survived a stroke, knowing that a trusted family member or friend is there to help can make all the difference in maintaining hope and improving overall health outcomes. Emotional support during recovery is just as important as physical recovery. Making lifestyle changes to prevent future strokes. While we've covered emergency responses like the 3-minute trick, it's also critical to understand how to prevent a stroke from happening in the first place. Prevention is always better than cure, and making certain lifestyle changes can drastically reduce the risk of stroke, particularly as we age. Addressing hypertension, high blood pressure. High blood pressure is the #1 risk factor for stroke, but it is also one of the most controllable. Managing blood pressure through a combination of diet, exercise, and medication can significantly reduce stroke risk. If you have high blood pressure, it's essential to work with your doctor to develop a treatment plan that works for you. Regular physical activity, staying active at any age. Seniors can greatly benefit from regular physical activity, even if it's just moderate walking or stretching. Regular exercise strengthens the heart and blood vessels, improves circulation, and lowers the chances of developing conditions like diabetes, which can further increase stroke risk. It doesn't have to be anything extreme. Just finding an exercise routine that works for you and sticking to it can provide numerous benefits for your cardiovascular health. Remember, it's never too late to start. Weight management and healthy diet. Being overweight or obese increases the risk of high blood pressure, diabetes, and cholesterol problems, all of which contribute to the risk of stroke. Maintaining a healthy weight is one of the best ways to reduce stroke risk. Combine a balanced diet with regular exercise to maintain a healthy weight. You don't have to overhaul your entire diet overnight. Small, consistent changes can lead to significant improvements in your overall health. Aim for nutrient-dense foods such as vegetables, fruits, lean proteins, and whole grains, while cutting back on processed foods, sugar, and excessive salt. The role of medication in prevention. If you're at high risk of stroke, your doctor may prescribe medications to help prevent it. Medications can help manage conditions like high blood pressure, diabetes, and high cholesterol, all of which contribute to stroke risk. Make sure to take your medications as prescribed and follow up regularly with your healthcare provider to monitor your health. Remember, strokes are a medical emergency, and quick recognition, immediate action, and preventive measures can all make a huge difference. By being prepared, staying calm, and taking action, you can increase your chances of surviving a stroke and living a healthier, longer life. If you found this information helpful, please share this video with your loved ones. You never know when they might need this life-saving knowledge. And don't forget to subscribe to our channel for more health tips and emergency response strategies. Your health is your most valuable asset. Let's take care of it together.
Thanks for watching, and as always, stay informed, stay healthy.